Hi, thank you for joining our third series in our airway management videos. Today we'll be looking at endotracheal intubation. I'm Darlene Hutton with QRS Educational Services. In our previous video, we looked at the acronym SLOPE, and those were 5 letters to remind us of what we need to have prepared in order to intubate within that 10-second time parameter. So we have all of our equipment ready. We have our endotracheal tube. It's been sized. The syringe has been attached to ensure that there's no cuff leak. We will also ensure that there is a bit of a stiffness to the tube. So by inserting the stylet but not extending the end of the tube, we apply a bit of a hockey stick shape, and that's going to facilitate the tube going into the trachea versus the esophagus. And it needs to be lubricated with a water-soluble solution. Prior to intubation, I will have donned my personal protection equipment, including gloves. So in this particular scenario, we are looking at a patient who is in a cardiac arrest. The oral airway has been inserted, and in this phase of a cardiac arrest with an oral airway, we will be doing a combination of 30 compressions followed by 2 rescue breaths. We need to ensure that we do not put air in while compressions are underway, otherwise air will go into the stomach, causing gastric distension, and that will impair gas exchange. As part of the SLOPE acronym, I have also taken out the end-tidal CO2 detector, which will be attached to the endotracheal tube once the tube is in the patient. And initially this internal part is a purple color, and once I've checked to ensure that it is in the correct location, this CO2 detector will detect that coming out of the patient, and it will turn this purple color to yellow. So we are ready to intubate. Needs to take place in no more than 10 seconds. And I ask my assistant to hold her breath, and if she runs out of air, so too will the patient. Okay, so stop compressions, please. And resume compressions. Okay, so now I'm going to take out the stylet while Christine inflates to no more than a soft grape, and that's all you need to make sure that there's enough pressure to maintain a seal. The end-tidal CO2 will be attached, and then the mask of the ambu bag has already been taken off, and we're going to do a 5-point check. So I visually have seen it go past the vocal cord, so I'm confident it is in the right spot, but now we need to do the second of 3 checks. So with my stethoscope in place, stop for 1 second, over the stomach, breath, over the stomach, over the chest, sorry, and lateral. Continue doing CPR. Good. So now that I have confirmed the 5-point check, I look to see that my paper is indeed jello, which tells me that this is proper placement. And we now have a proper advanced airway. So compressions need to be going at least 100 compressions a minute. And now we are not going to stop compressions with an advanced airway. And airway is going to be maintained at 8 to 10 breaths per minute. So in your mind, you count every 6 to 8 seconds and you deliver a single breath. I will ensure that this has been secured to the mouth so it doesn't move, doesn't get displaced, and we will do confirmation by an X-ray. I hope you've enjoyed this video. Thank you to Cheryl and to Christine for their assistance. For more information on these video series, please visit our website. Thank you.